David is a very bright guy. He's funny. He's a total vintage car racing nut. He volunteers at the LeMay Museum 1 day a week.
The thing I like working at the LeMay American Automobile Museum is the, number one, the cars, but almost more importantly is the people that are there. It's like a big family.
When I first met David, I wasn't too sure because a mutual friend arranged our meeting and he was late. So it was like, well, maybe this won't work. But 35 years later, here we are.
Well, it seemed like a normal day at the Auto Museum, and things were working just fine, but the last thing I remember was walking out of the restroom, and that's all I remember until Connie, 8 days later, told me that I'd had a heart attack.
I had just come home from running errands, telephone rang. It was the LeMay Museum. He had collapsed.
David was found collapsed on his stairwell by a staff member. I immediately responded to the scene with the AED machine. There was an EMT already on the scene performing chest compressions.
He was on his way en route to St. Joe's. When I got here, it was like, we don't know if he's coming or going. We don't know what's happening with him. We don't know if he's going to make it or not make it.
Mr. Bean arrived at St. Joseph's Medical Center emergency room following a cardiac arrest he suffered in the field while at work. He was initially resuscitated by emergency personnel, arrived here critically ill, on life support.
When I was speaking with Mrs. Bean during his presentation to the hospital, I explained to her the gravity of his situation. While the outcome was undetermined at that time, I gave her a promise that I will treat him like I treat my own family.
Heart disease is the leading cause of death in America. It's estimated about 1 in every 4 people die of heart disease. It's also known that roughly 320,000 people have sudden cardiac death each year. This is a tragedy for American families.
Atrial fibrillation, for example, affects 5 million Americans. And over the next coming couple of decades, we expect that number to actually triple.
Numerous debilitating and even fatal heart conditions, collectively known as arrhythmia, result when the electrical system of an individual's heart no longer functions reliably. That's where the brilliant heart electricians of Franciscan Heart Center's EP Lab provide leading-edge care that preserves quality of life and saves lives.
Patients who have electrical problems sometimes experience symptoms of fluttering in their chest. They may get dizzy, they may get short of breath, they may pass out.
Things got worse. I started having the AFib at least every 10 days, be out in my kayak. My grandkids and I love to camp, and I'm an instructor, and it was very difficult for me to not know if there was going to be something that would happen in front of my class or while I was out kayaking. I had my AFib episodes. What I would find is that I was very exhausted, and mentally it was not very pleasing, the unsureness of what was going to happen next.
Electrophysiologists are what you would consider the electricians of the heart.
In our EP lab, we treat different patient pathologies, including life-threatening arrhythmias like ventricular tachycardia, or life-altering arrhythmias like atrial fibrillation, with either ablations or medications. Sometimes the patient may need a device intervention, like placement of a pacemaker or a defibrillator.
The vision of CHI Franciscan Health is to be the premier health system for the Pacific Northwest. It's important to have this technology and this electrophysiological care in the South Puget Sound for our community.
For us, living in Olympia, it was wonderful to be able to come to Tacoma for the care we needed.
We bring the patient care to you, the most recent advancement in medical care, the team approach, as well as our most founding principle, which is caring about you.
Mr. Bean underwent the implantation of a cardiac defibrillator. This is a device that's placed either in the chest or under the skin on the side of the chest that allows us to monitor heart rates This can also deliver a shock in the event he has another rhythm issue such that he suffered initially, causing his cardiac arrest.
David did get better. He had a defibrillator put into his chest. Our experience at St. Joe's was wonderful. We were totally impressed by the nursing staff, the doctors, the other doctors that came in. I mean, seemed to be multitudes of them. It was a long recovery. He spent weeks in rehab. He worked very hard to get himself back to where he is today.
Since my procedure at the St. Joseph's EP Clinic, my life has dramatically changed. I feel much more confident about going out by myself in my kayak, getting down on the floor with my 3-year-old granddaughter, and not having to worry about, is something going to happen?
When I received the letter from Mr. Bean describing how his life is and his recovery after his cardiac arrest, and how he's doing the things that he used to do again, that was the highlight of my experience with Mr. Bean. This is the reason that we do what we do.
What I'm most grateful for is the health of our family, primarily David at this point.
The feelings you get is, number one, the happiness of being whole. A lot of times we take life for granted and go along with that. The other thing is closeness to my wife and kids and my close friends, and who I'm fortunate to have a few very good friends, and so you have a new appreciation of life.